Bone's a dynamic and active tissue. It goes through periods of absorption and redeposition. So its architecture changes in response to the environment. So we talk about, for osteoporosis, it's recommended that you do typically weight-bearing exercises. Okay? So weight-bearing exercise is going to be something, if you're going to walk, go ahead and put some weights in your hands. So anything that's going to be put more stress on the bone, that's going to give it a reason to strengthen itself. Whereas if somebody's sedentary, bedridden or something like that, then there's not as much of a reason for the bones to stay strong, so calcium might get reabsorbed. Because the bones, like I said, are a storage bank for calcium. So if the body needs calcium for other purposes, it's going to have to take it from the bones. So constantly, it's like a bank. You know, sometimes you make deposits, sometimes you make withdrawals. And then there's constantly small-scale changes depending on the architecture of bone that occurs on an ongoing basis. And we talked before about which of the cells that lay down the bone are the osteoblasts. So if there's an injury or a fracture or more stress is being placed in the bone that needs to strengthen it, some mechanical weight-bearing stress, then there's going to be more calcium laid down. And then reabsorption. Reabsorption is when you need to make withdrawals out of the bone bank in the bones, in the calcium plant. So that's going to be the osteoclasts. So osteoclasts are going to go in and break down the bone and release calcium into the bloodstream for other purposes. And then there's different hormones that relate to the calcium. So when the blood calcium level goes low, there's hormones that are going to kick in that are going to tell the body that it needs to generate more calcium, and it's going to take them out of the bones. So that's going to be regulated by the parathyroid hormone, and then also calcitonin. We'll get into a little more detail on that. So when the hormones kick in, is that rising blood levels in the thyroid is going to recognize that, and then it's going to release calcitonin. So the way that usually I remember it for the mnemonic for calcitonin is that calcitonin, it tones the bones with calcium. So calcitonin is what's going to help put calcium into the bones. Calcitonin is going to stimulate calcium deposits in the bones, and then if it falls down, so if there's low levels in the blood, then the parathyroid hormone is going to kick in, and that's what's going to cause bone reabsorption, where the calcium is going to be taken out of the bones and put back into the blood system. So the parathyroid hormone, again, it's the osteoclasts that's going to break down the bone. So the parathyroid hormone stimulates osteoclasts.
Yeah. Is that calcium used for digestion and muscle contraction, or?
There's a few different things. It's it's used for conducting nerve impulses. It's used for neurotransmitter things, maintaining. Calcium is important in muscle tone, things like that.
So for all uses, it's stored.
That's the only place that really calcium is stored. And then that's where the body's going to go to if it needs extra calcium. It's going to come out of the body.
So like during exercise, it'll take it out of the bones.
I think it's not like a peak thing like that. It's probably more of a slower type of thing. Just on a constant basis, your body's monitoring the blood levels of it.
Okay.
It's not like a thing where you need glucose for exercise. It's not a quick, fast-acting thing like that. I would think it's probably more of a slower, more level, maintained type of thing. Because we're not talking about big fluctuations in levels. Like you talk about blood glucose and things like that, energy, it can spike and peak like that. Whereas the calcium levels, if it has a slight variation, then it's going to start kicking in to maintain those levels. And it's not like in glucose and glycogen, things like that, those are getting burned up and used. The calcium's still there. So it's not like your body is excreting the calcium or it's gone for good. It's just shifted from one point to another. So then, like I say, the parathyroid hormone is going to stimulate the osteoclasts to increase the blood levels of the calcium. So it's going to release calcium into the blood. So then this is kind of just a diagram of how this is constantly going on. You know, it tips the scales where if you have the decrease in the blood calcium level, then the thyroid's going to stimulate parathyroid hormone. That's going to cause the osteoclasts to break down bone tissue to release calcium into the blood. Then it starts getting too high. You have too much calcium in the blood. Then you're going to have the calcitonin. It's going to be secreted, and then that's going to cause the bones to get toned with calcium. So there's going to be calcium going into the bones. So calcitonin has to do with the cycle of putting calcium back in the bones. Parathyroid hormone has to do with taking calcium out of the bones and putting it into the circulating blood system. All right, so then now we're going to talk a fair amount on the section here on fractures. Okay, again, you just need to understand the basic idea behind fractures. We're going to talk about a lot of different specific types of fractures that's not necessarily going to be covered on the quiz, but the thing is that, you know, you'll have patients that have fractures and you want to know what types of fractures are there. Some of the bigger types of things like compression fractures. Okay, so we'll talk a little bit more about those types of fractures. And then there's different ideas that you want to talk about. Is it displaced fracture or non-displaced? So displaced fracture means that the bone is out of position. And then also other complications of fractures have to do with whether it crosses the joint line or not. Okay, so fracture that crosses the joint line, you know, a lot of times that may be something that where they're going to need surgery or things like that.
I think you mentioned earlier that a sprain can sometimes be worse than a break. Why was that again?
Okay, when the question is why can a strain or a sprain be worse than a fracture? Okay, you've seen all this stuff with the lamella and the cocoon and the osteocytes and osteoblasts. When bone heals, it heals with bone, which is the same as it was before it got broken. The actual microscopic level of it. Okay, so bone heals with bone, and it's pretty much the same as it was from before. Okay, it may be displaced or it may be irregular if there's displaced pieces, but when it taught, we'll get more into maybe with muscle, but you know, let's say you have a tendon, it's connective tissue like this, right? When the connective tissue gets torn, okay, it's going to get healed with scar tissue. And the body all of a sudden says, we've got to lay down some scar tissue fast. Okay, so it's just, you know, it's filled in and it's not irregular like that. I mean, it's irregular. It's not the normal same fibers as it was before. So that's scar tissue. Within a couple of weeks, that's going to get laid down, and then that's when, you know, let's say you have a sprained ankle, it starts to, the swelling's starting to go down, they're starting to be able to move it a little bit better. But it's not the same as it was. Okay? Gradually, especially if you have, like they have those passive continuous motion machines, like if you have knee surgery, they put you on those machines that where it starts moving the joint. So if those tendons are subject to movement, then gradually they're going to have a reason where some of that scar tissue is going to be replaced with some of that original tissue. It's not going to be quite the same. Okay? You know, ligaments can heal, but they're a lot of times going to be laxity. You know, if anybody's ever had a sprained ankle, you do it enough times, your ankle's loose. Okay? It's not the same. There's laxity. If something gets pulled and stretched long enough or far enough apart, it's not going to be as tight as it was. Whereas bone is bone. Okay?